I've just come back in time to tell you that the content in this video is unbelievably awesome if you're looking for some great floor exercises for core strength and mobility. And these intros are getting really cheesy, so I'm going back to the future. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today we're going to be looking at some gentle exercises that you can do daily to help break up periods of long sitting and activate some of these core muscles. If you're here for a six-pack or a flatter stomach, you're in the wrong place. You might want to look for those elsewhere. We're going to be focusing on looking at the deep core muscles that help stabilize the spine. So the term core refers to a group of 35 different muscles that act upon and support our center, particularly the hips, the pelvis, and also the lower part of the back, the lumbar part of the spine. And it's worth noting that the lumbar part of the spine is actually the only skeletal structure that goes to support the upper body, so from the ribs upwards, with the lower body, so from the pelvis downwards. Generally, if we spend lots of periods of time in a seated position, we tend to then not engage these core muscles, so they kind of deactivate, and they only engage again when we come to sit upright or come to a standing position. So if we're sat down for a lot of period of time, or we're not actually doing much physical activity, then what can happen is the core muscles can become a lot weaker, just like any other muscle that's not used in the body, and then that can then lead to an increase in lower back pain. So we're going to be doing 5 gentle exercises today that help activate these core muscles, and these can be done every day. You don't have to do all of them. You can just pick 1 or 2 that you prefer, that you find that benefit you the most. If you've recently had any spinal surgery or being treated for a serious back condition, then it's probably best to take the advice given by the health professional that you're under, as that will be specific to you. But these generalised exercises are very gentle and will be safe for most people, including those with muscular lower back pain. Now I'm going to show you these exercises on the floor, but I appreciate not everyone watching this will find it easy to get down onto the floor and then back up again. So you could do this from a sofa, you could also do this lying on your bed as well, but really you want a firm surface to be led on because that helps with the mind-body connection, so you can actually feel the muscles that are being worked. You might also need a cushion to be able to place underneath your head to support your head and your neck as well while you're in that led down position. And anyone that suffers from lordosis of the spine may feel to have another shallow cushion just to be able to support that lower part of the back. So if you want to get yourself ready, and then we'll start going through these 5 exercises. So let's start then with the first exercise, which is called a pelvic tilt. Essentially, tilting the pelvis, whether in a standing, seated or lying position, will actually mobilise the lumbar part of the spine. So this movement will either decrease or increase the curve in the lower part of the back. So if I do a forward tilt of the pelvis, you'll see naturally then I get more of a curve into the lower part of my back. And if I tilt the pelvis backwards, then it begins to then flatten that lower part of the back. So we're going to do this in a lying position. So I want you to lie yourself down on your back. Make sure that you've got your feet a shoulder width wide on the floor and the heels of your feet are relatively close to your bottom, so that they should stay flat. Feet and knees should be the same width as your hips, and then you'll probably want a cushion, grab my cushion, to support the head, the neck and the top of the shoulders, just so I don't feel like I'm straining my neck. So from that position, naturally if I'm in a relaxed position on the floor, I should feel this gap underneath the lower part of the back, and there will be some people that have got more of a curve in their spine than others, so you might have more of a gap in it, and other people that might not have any gap at all. So what we're going to try and do with the pelvic tilt is we're going to try and press that lower part of the back down into the floor, which will then create this tilt of the pelvis. So before we do that, we're going to engage your core muscles, which will just then brace the spine slightly. So by doing that, imagine like you're trying to get into a tight pair of trousers and you're going to suck your stomach back in on itself. So it's pulling the belly button back down towards the spine. While we hold that position then, we're going to think about pressing that lower part of the back down into the floor, which creates this little pelvic tilt, and then we'll then reverse it and go back the other way. So it's just a gentle movement. We're pressing the lower back down into the floor and then reverse it to come back to the start position. Now you probably won't see very much movement, but all I'm trying to do there is forward tilt the pelvis that way and then backward tilt the pelvis, which is pressing that lower part of the back down into the floor. The rest of the legs should stay relatively relaxed as well as the upper body. So we're just getting that mobilization of that pelvis just to start to engage some of these core muscles a little bit. So I want you to do 5 of those, just gently in your own time. And then once you've done 5, then you can relax. Okay, good, well done. Okay, so we're going to go on to our second exercise, which really continues from the first pelvic tilt that we've done, and we're going to go into a bridge. So essentially the setup's exactly the same. I've still got my feet shoulder width wide, I've still got my knees shoulder width wide too, but basically from there is I'm going to do my pelvic tilt first. So I'm going to press that lower part of the back down into the floor. You'll feel the tailbone of the spine begin to lift up, and then we're going to continue that by pressing through the heels of the feet, squeezing the buttocks together, which will start to get a little bit of a lift of the hips off the floor, and then we reverse it to go back down. So again, it's a nice slow controlled movement, so I'm really pulling the tummy in, flattening the lower part of the back into the floor, pelvis tilts backwards, and then I extend, pushing through the heels of the feet to start to get the buttocks to squeeze together, lifting the hips up off the floor, and then reverse it as you go back down. Now just when you're doing this, be careful that some people you might see doing a bridge will kind of really throw their hips up as high as they can, which then puts hyperextension into the lower part of the back. So we don't want to go that far, that's going too much. We just want to get the pelvic tilt first, and then we want to really try and engage these glute muscles, which are your buttocks. So think about squeezing your bum cheeks together to get the little bit of a lift, but you're still trying to flatten that curve of the lower part of the back at that point, and then lower back down. Another tip for this is making sure that you're pushing through the heels of your feet, so you're not trying to push through the toes. If you push through the heels of the feet, that will just help engage the glute muscles just a little bit more, so you're just really concentrating on everything around the core area, and then lower back down. Okay, again, same with the last one with the pelvic tilt, so you want to try and do 5 of those, slow and controlled. Remember, try and get that mind-body connection so you can really feel the muscles being worked, and then once you've done 5, you can then relax. Right, so the third exercise we're going to do is a foot slide. So for this one, we'll adopt this exactly the same position as we did with the first and second one. So feet and knees hip distance wide, make sure you've still got the cushion to support your head and your neck. And I want you to place the hands this time just on the top of the pelvic bone on either side. So where your pelvis is, right on the top here, just below your waist, that's where I want you to keep your hands. And the purpose of that is when I'm doing the movement with the legs and sliding the foot out and back again, we want to use this to see whether you feel that your pelvis is moving, because if you find a shift, so you feel that this one's popping up or this one's popping up, then you know you're not utilising your core to stabilise your spine in the same position. So the movement is then, I'm going to place my hands on the top of the pelvic bone either side. I'm going to embrace my core, I'm going to keep my lower back fixed, so the position of my lumbar spine is not actually going to move in this one, like we did with the last two. So from there I'm just going to slide one foot forwards gently, but because I'm doing my right leg, I'm going to really keep thinking about what's happening with my right hand to make sure that this doesn't lift up. If I feel any movement, then I know I've gone too far because my core's not strong enough to be able to hold and fix my spine position. So as I move it forwards, sliding the leg out, if I can get it straight, fantastic, as long as there's no movement here on this side of the pelvis, and then I'm going to withdraw it back to the start position. And then what I do is I switch sides, so then do the other leg. So I just gently slide that foot out until the leg's straight. I'm being wary of what's going on this side, on the left side of my pelvis. There's no movement there, so that's good. And then bring it back to the start position. So just to make sure that the pelvis doesn't move on this one, we want to really focus on pulling in the core muscles. Remember, thinking about pulling in the belly button back towards the spine, and that will really embrace it to stop any movement or limit any movement. If you find that one quite easy and you can comfortably get the leg out straight and back again, then there's a progression on this one where you can lift the legs up, so I've got my knees and my hips bent at 90 degrees. And then from there I can do exactly the same thing. So I've got my hands on the top of my pelvic bone, and I'm just going to let this leg drop this time till it goes out straight, but I'm really having to work harder this time, so I've got no support with the other foot. Then my core's going to have to work that much harder to make sure that it stabilises my spine. And again, I do alternating legs very slowly, just making sure that there's no movement of the pelvis, so that way then I know my spine's being supported with the core. So you can choose whichever one suits you, and again I want you to try and do 5 of those each leg. Right, for the fourth exercise we're going to do what's called the clam, and with this one we need to now change our position so we're on our side. So if you roll over onto one side, again make sure that you've still got the support here for your head, so your neck's in a straight line. If you feel that you need an additional cushion underneath that hip that's on the floor, then obviously put just a thin cushion underneath there as well if you need it. My feet position are going to be the same as when I was in lying on my back. The only difference is the legs and feet are together this time. So make sure the feet at the back are in line with your bottom and your back. so that they're not out here in front somewhere. And make sure you've got your feet together, knees together, and then your other hand you can just place wherever you feel comfortable. So to do this one, what we're going to do is we're going to work particularly through the hip on this side. So in this case, it's going to be my left hip. And just make sure you're in the sideline position, pull the tummy in, and the movement is just to lift this top knee away from the bottom knee while pivoting on the feet. So my feet are staying together, but I'm just lifting one knee up away from the other one, hence the name Clam, and then lower back down. So this is externally rotating this hip joint. Be careful when you do this that you don't end up moving the body. So the body should stay dead still in a sideline position, and we're just going to lift that knee away as far as you feel comfortable and then lower back down. And you'll feel the muscles, these gluteus muscles, particularly glute medius, which is the one around the side of the hip, you're going to feel that activate as you lift that top knee away from the bottom one. So make sure the body stays dead still. It's a nice slow steady movement, but you should feel that around the top of the hip. Remember, the core muscles make up the support around the hip, pelvis and the back. Okay, do 5 of those gently. If you find that's particularly easy and you don't really feel it's challenging those muscles on the top of the hip, then you can actually get hold of some resistance bands. So I've got a selection here. You can pick these up from Amazon, and I'll leave a link in the description for those. But they basically offer different strengths. So you can actually have one of these around the knees, and then basically then as you do the exercise, you'll be stretching the band, which will make it that little bit harder because it's adding a little bit more resistance. So that's an option if you find that just doing the Clam itself is a little bit too easy. Again, do 5, even if you do it with the resistance band, you can progress that with different type of resistance band to make it harder, but you should feel that working around the top of the hip. So once you've done 5 times on one side, you then obviously need to then flip over and do 5 times on the other side as well, just to keep that balance in the body. Okay, so the last exercise then is a sideline leg lift, and for this one, this is going to be a little bit more challenging because you'll find you feel like you're trying to retain your balance while you're doing the movement. So we're going to start off in the same sort of position as what we did with the Clam. The slight difference is we're going to straighten the leg and the hips out. So I'm going to go to this complete sideline position so that I've got one hip over the top of the other, so everything's completely straight, and I'm just going to place my arm straight down on the side of my hip. So the movement from here then, because it straight away you should feel like you're either going to go forwards or backwards. If you feel that your balance is compromised too much, then you can straighten out this bottom arm just to provide a little bit more stability on the floor. But to make it more challenging, then you want to bring this arm in closer to you so there's less of a support, so it feels your core muscles are going to be a little bit more challenged. So in this sideline position then, what I'm going to do is I'm going to lift this top leg away from the other one. So this is called abducting the hip. So it means taking it away from the center line of the body as I go up, and then control it slowly as I come back to the start position. Now as you raise the leg, ideally we want to try and get a little bit of rotation in the leg. So you'll probably notice that my foot's actually pointing down towards the floor slightly rather than pointing up this way, which is going to open the hip up. We want to close that round the other way, and that will then really enhance engaging the muscle here on the top of the hip, this glute medius muscle. So as you're raising the leg slowly, keeping it straight, just raise up as far as you feel comfortable. Again, core muscles are being constantly engaged. I might feel like I'm having to control my movement a little bit to stop me from losing my balance lying on the floor. If you'll find that's easy, you can do 5 slowly comfortably without feeling that challenged, then we can progress that by actually bringing the arm up that's on the top. As I raise my leg, I'm going to bring my arm up over the top, and then I'm going to return it back down slowly to that start position. So now it feels a little bit more wobbly as I'm doing the movement, which means I'm challenging my core muscles that little bit more. So again, 5 times slowly on one side, and then 5 times slowly on the other side. If you feel that you need that support for the hip, again, just put a very thin cushion or something underneath the right side of your hip, or the bottom hip, just to provide you with a little bit more support. Right, so I hope you enjoyed those 5 exercises. Remember, you don't have to do all of them. You can pick and choose ones that you think you prefer to do. I'm just going to give you a bonus one, and this is a little bit more of a mobility exercise really, because it's going to rotate the spine. And you can do this first thing in the morning, last thing in the evening after you've done the exercises. It's quite a nice way to loosen everything up a little bit. So to do this, you're just going to have your feet go back into your back lying position, but this time feet together and knees together. So rather than having it like we did before with the pelvic tilt, we're going to bring the feet and the knees together. Again, make sure you've got something to support your head. Hand position, you can just put your arms out straight just to the side on a bit of a 45-degree angle. And the movement then is just I'm going to drop my knees over to one side, which is lifting the buttock on that one side off the floor. Now, depending on your mobility, mine's not particularly great, will depend on how far your knees will be able to go over to one side. The crucial thing as you're doing this movement is to make sure that your back doesn't come off the floor. So if my shoulder blade lifts up, then I've gone too far. So you should find you have to keep the shoulder blades flat on the floor, allow the knees to drop to one side so the pelvis is twisting, so the spine's twisted at the bottom, but I'm still managing to keep my shoulder blades flat on the floor. As soon as you've gone as far as you can, you'll feel a bit of a stretch across the oblique muscles here. You might feel a bit of a stretch around the lower part of the back and maybe into the glutes as well. Then return back to the start position and do the same on the other side. This will work the core muscles a little bit because your core muscles are being worked to try and stabilize how far you actually go. So you don't want to try and go too far. So do it in a nice, steady, controlled manner. And you can just do that gently 5 times on each side. So there's a little bonus exercise for you to do. And you can do that any time of the day. Okay, well done today. I hope you enjoyed some of those exercises and gives you some ideas on how you can work your core, but doing it gently on the floor. If you enjoyed today, please give it a thumbs up to like it. Feel free to comment below on anything if there's anything you're not sure about, and I'll do my best to respond to those comments. And also, if you haven't subscribed yet, it's worth doing that because I try and post up a video every week. All right, so with that, hopefully I'll see you again soon. Well done. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.